Alison Ledson has worked for the NHS for over 3 decades.
I've got a patient to hand over to you.
She loves her job as an A&E matron, but without enough staff to go round, she's forced to rely on the goodwill of her nurses.
Our patients are getting good care, but that's based on the staff doing extra, going above and beyond, and staying late to make sure that things are done properly.
Is it sustainable?
It's not sustainable. I'm seeing higher levels of sickness rates, and generally speaking, staff that are tired of coming in and working with one less staff member on shift than they should have.
Somehow, the staff here have managed to lift the trust out of special measures, despite being 401 nurses short. And they're not the only ones. We asked every trust in the UK how many staff vacancies they currently have. 92 trusts responded. In Northern Ireland, the Belfast Trust, which manages 8 of the city's hospitals, has 1,236 unfilled vacancies. While Bart's Hospital in London, the biggest hospital in the country, has 1,732 vacancies. But it's not only nursing positions that are going unfilled. North Cumbria has 48 vacant consultant roles, while Calderdale and Huddersfield has 44 consultant roles going unfilled. Many chief executives tell me that finding the right number of people with the right mix of skills is now the toughest part of their job. And while some gaps can be filled with agency staff, all of this has an effect on patients. There simply aren't always enough staff to run services safely.
Trusts may well need to shut wards, and we do see that up and down the country. We also know that they may need to cancel operations, and what it means as well is that they need to employ expensive agency staff in order to cover those gaps and run a safe service.
The Health Secretary points out there are now 15,000 more nurses than 6 years ago.
The truth is you can't magic up doctors and nurses. They need to be trained. We've increased the number of doctors we're training by a quarter. We've made big reforms to nurse training, and it will take time before these new doctors and nurses come into the system.
Until then, staff who feel as underpaid as they're overstretched will be asked to shoulder the burden.